The Supreme Court has now heard arguments on the explosively controversial Patient Protection and Affordable Care Act, known in many circles as Obamacare. The mandate requiring all Americans to buy health insurance, or the entire law, could be struck down. One or both could survive. But as the court ponders its decision, we should not lose sight of the big picture when it comes to health care, and that is, what happens if this law does go down? For if we didn't have real problems with the current healthcare system, this law would never have seen the light of day. Long before this law was ever passed, the costs of healthcare were skyrocketing. Consumer choice effectively did not exist. And excessive government and insurance industry regulation was driving more and more doctors out of the business. So no matter your view on this law, we must acknowledge that our largely employer-based healthcare system really does need to be reformed. And if this law does not survive, we will miss the opportunity of a lifetime if we fail to replace it with true market-based, common sense, and sorely needed reforms. What's driving the cost of healthcare is the third-party payer system that gives doctors and consumers no incentives to be cost-conscious. When your doctor prescribes a procedure, your question should be, what does it cost? Instead, your question is invariably, is it covered? That's what causes such inflation in healthcare, a system rigged to promote overuse and abuse. A major step toward a free market would be a dramatic expansion of personal health savings accounts that allow people to control more of their own money, make more of their own healthcare decisions, and thus take greater control of their own lives. This by itself would lower costs, increase choice, and improve the quality of care. And there are many other reforms that would significantly lower costs and remove millions from the rolls of the uninsured. Tort reform that will limit the size of malpractice awards, removing the senseless barriers to buying insurance across state lines, establishing small business cooperatives that will allow many more small businesses to offer health insurance to their employees. You can't replace something with nothing. The American healthcare system is still the finest in the world, but without free market reforms, it's doubtful that it will stay that way. For One Generation Away, I'm Tim Donner.